Well, the prevalence of autism spectrum disorder continues to grow, with 1 in 54 kids being diagnosed. As a result, the demand for therapists and other specialists to help kids with autism far outpaces the supply. That's why an Indianapolis-based autism treatment center is planning a major expansion. Business of Health reporter Kylie Valletta here with more. Kylie.
Well, thank you, Gary. Hopebridge Autism Therapy Center started about 15 years ago in Kokomo when its founder realized kids with autism weren't getting the therapy they needed. What started here in the Hoosier State has now grown to one of the largest autism therapy healthcare providers in the nation, with centers in 6 states. And Hopebridge is now planning its largest expansion yet, opening up to 20 new centers, including a new one in Elkhart. Joining me now to tell us more about the growth is Kim Strunk, the founder and chief clinical officer of Hopebridge. Kim, thanks for being on the show today.
Thank you, Kylie.
All right, so you have a big expansion coming, but first of all, let's talk about what you already have in Indiana, 18 centers. The new one in Elkhart will make 19. And you say what really makes Hopebridge unique is its approach to care, which is called Hopebridge 360 Care. Tell us about that approach.
Sure. You know, our mission at Hopebridge is to be able to provide access to children with autism for services that are appropriate. And part of that is making sure that we bring in a variety of specialists that are able to participate in that care. So one of the things that really sets us out is our diagnostic services. A lot of children run into kind of a bottleneck in being able to access intervention because they don't have a diagnosis. And sometimes the wait list can be up to a year in order to get diagnosed. So we brought diagnostics into our service mix in order to help increase that access. The other component that is important for these families is just convenience. And so having occupational therapy, speech therapy, and their ABA therapy under one roof really allows them to be able to access all the services at one time, and it's more convenient for them.
All right, and this expansion up to 20 new centers in the 6 states. Why did you see a need to open all these new centers?
You know, the prevalence of autism continues to grow, 1 in 54 kids. And it's just amazing that the communities still have such a great unmet need. And so, again, our mission is to increase access for children to appropriate care. And so we continue to find communities that need services, and that's where we're going.
All right, so let's talk about the pandemic. I think it's been hard on children everywhere for a lot of different reasons, but especially hard on kids with special needs. What kinds of challenges have you seen families with kids with autism struggling with during the pandemic?
Yeah, the pandemic, as you said, I mean, it's been hard on everybody, but special needs children particularly hard, and families that are trying to maintain some type of continuity of care for their children. That's been a real challenge for services that get interrupted. You lose that continuity of care, and it's so critical to avoid any type of regression in their skills. The other is social isolation. And for children with autism, social skill development is really a hallmark challenge for them. And so the isolation that the social distancing and the restrictions have put onto these families has only compounded that. And then you add in, as the kids are going back to school, mask wearing. A lot of these kids have sensory challenges and sensory aversions. A lot of them have communication issues. And so the mask wearing inhibits and causes problems for them in those ways as well.
And do you think all of those challenges have really underscored the need for your services?
Absolutely. I think it's more important than ever, and we have worked very hard as essential healthcare providers to stay open in a safe manner so that our patients and our staff are safe. But it is really critical that these kids have that continuity and that we're available to address their needs.
All right, so we've talked a lot about the care you provide, but also a good business angle to this. Talk about some of the advantages that your company brings as a business to a community.
Yeah, one of the great things, obviously, priority is providing excellent care for these children and their families. But the other thing when we go into a community is to be a partner with that community and provide jobs. So, we're committed to providing jobs in every community that we go to. So we will, in the year 2021, be offering 400 new jobs just in the state of Indiana alone. So with all of our expansion opportunities, we continue to bring specialists in. Those specialists are licensed professionals that are coming into those communities to provide jobs for those communities and those families.
All right, very good, Kim. Thanks for being on the show today, and good luck with all of the expansions.
Thank you, Kylie. Appreciate it.
Gary, back to you.